Guys, today's video is going to be peptides for dummies. Whether or not you know nothing or little, after this video you're going to understand everything you need to know about peptides and where to get started on your peptide journey. And let's get into this. So what are peptides? Peptides are pretty much a little chains of amino acids that are going to be used subcutaneously or through nasal. Me personally, 99% of peptides are going to be used through subcutaneous. So this is going to be used within a little insulin syringe. Now these are going to be on Amazon. You can check out everything that you need inside the link in bio, and that's where you're going to find all of it. So the basic essentials to getting started before you even buy a peptide, what do you need to get started? First off, you're going to need insulin syringes. This is how you're going to use them. So this is a 0.5 31 gauge from Amazon. This is pretty much the go-to, most comfortable. It's not going to hurt when you use it. It's very much so popular use. Now, you cannot use this for anything oil-based as of gear or anything that's just in an oil base. Only water-based peptides. So take note of that, okay? You cannot use this for anything else other than peptides. Number 2, basic essential need, alcohol wipes. This is going to be used to wipe down whatever spot you're going to inject into. Now we can get into injection spots after this, but we're going to, first off, you need these. These are going to keep you clean, less risk of infection. You're going to clean the top of the vial, and then you're going to clean your skin. This is just basic procedure. Don't even question it. Buy it. It's like $5 for like 3-pack of like 300, okay? Let's not get infection. Third essential that you're going to need, you're going to need reconstitutional solution. Now, when peptides come in, they're going to be in little powder form. You're going to need to turn them into a liquid form so you can actually, draw them in a syringe and use them. You're going to use this. This is little benzenate alcohol. This is just basic stuff you're going to need. It's like 20 bucks. You get 2 vials of 30 ml. It's perfect. It's on Amazon. Very, very simple to get. Very good. You're going to need to get peptides. Now, if you're wondering where to get them, there is 3 different ways you can get them. You can get them through a licensed, like, pharmaceutical place, or you can go through a gray market. Now, there is online gray markets that are going to cost more because they're doing third-party testing on every single batch. They're going to guarantee that it gets to you, and also very quick shipping. So you're paying for the 3 luxuries of it, but otherwise you can go into the gray market, which is, there's the gray websites, and then there's the gray market where you're going through someone on WhatsApp, and you're kind of risking your money. You could get scammed. You could get impure peptides. There's a lot of risk you run into. So as a beginner, like cost effective and safety effective, I go with the middle gray. So the peptide websites, which is Solution Peptides, all the links in the bio are reputable peptide suppliers that I supply. Also, I'm not affiliated with them at all. I'm not a sponsor, and it's not for human consumption. You're also going to need a reconstitutional syringe. Now, the reason why you're not going to want to use your 0.5 syringe is because you're going to need to draw like 6 of them or more. You're literally going to need to draw a bunch of them when you could just do it in one easy pull and just get it over with really, really quickly. All right, now we're going to go do a reconstitutional and show you exactly how I would reconstitute it for you guys. Okay, so this is kind of a hands-on point of view on how to reconstitute. So first off, you're going to need to get your reconstitutional syringe and open it out of its one-use package. So after you use this, you will never use it again. All right, so first off, you're going to clean your equipment. So this is my peptide vial. You just pretty much rip it off, okay? Pretty simple. This is going to be vacuum sealed, which is just, it's going to be a little annoying at first, but it's okay. So we're going to clean off the lid, okay? And then we're going to clean off our vial, and then, clean off our hands. So, oh, whoops. Sorry, I gotta screw that in. So we're going to get this reconstitutional syringe. This is going to be used for the reconstitution of whatnot. So let's make sense. So an average thing for this is going to be 3 ml of backwater. So I get my 3 ml of water and whatnot. So these are going to be vacuum sealed. Now this doesn't make much sense how this is going to fit in there, but you'll see soon. This is going to be vacuum sealed, by the way. So it's going to suck in very, very quickly. So what you're going to do is you're going to want to almost hold on to this so it doesn't go too quickly, and you're going to drip it onto the side. Hopefully I can do this kind of like, can't focus. Maybe it can focus. Okay, well, is that fine, guys? Okay, so we're going to drip it onto the side. Poke it into the side. Pretty much drip it in. So it's going to want to suck in pretty quickly, but you want to drop it in through the side. So it's going to drip down the side. It's going to get through the first, it's going to try to pull very, very quickly, but you do not want that to happen. You just want to drop it down very, very quick, slowly. Sorry, I'm kind of hiding the liquid, but I'm dropping it so slowly. So it's going to take my speed up. Okay, so now that we've done that, we're trying to get an alcohol wipe, and then we are going to clean off the lid. So
there's still going to be a little bit of powder at the bottom. So how you're going to swirl this, so get away your stuff, how you're going to mix this is you're going to get it in between your hands, clean hands, and you're just going to spin, okay? So you're trying to pretty much spin this, do some very gentle tilts, just like down, up, down, very gentle. You're just going to be as gentle as possible before, you're just going to be gentle so you don't destroy it, because there we go, it focused in. So there we go. But you're just going to pretty much move it up and down very, very slowly and just let it mix in. So just slow and steady, and you're just going to twist it and whatnot, twist it in all different ways, and then over time, it will mix in. But for this video's sake, we're just going to end it here. But that's how you're going to reconstitute a peptide safely, sanitarily, and pretty much just how to do it overall. And we will never use this again unless we're reconstituting multiple peptides at once. We just will toss this away.
Now that we know how to reconstitute and where to get everything, we need to pick out the peptides that we want. So there's going to be a big, big list, and I'm just going to give you guys the 5 basic ones that I would ever start with. Actually, we'll do like 3. But the basic ones are going to be, we're not going to run into any weird side effects where we need to take, extra supplements to combat it or anything. Just basic ones that are going to be very much so a lifestyle change. First one, GHKCU. This is a copper-based peptide. It's going to boost collagen production and pretty much heal your skin. You're going to be glowing. It's very, very good. I use it all year around. It's my favorite. It's cheap. It's just the best peptide overall for a beginner. You're not going to have weird flushing or water retention. You're just going to have the benefits of using a peptide for your first time. Second is going to be the Wolverine stack. This is by far the most popular stack pretty much ever inside the peptide community. It's going to pretty much fix any nicks or bumps on you. It's going to be anti-inflammatory. It's going to be great. I actually tore my AC joint back in football, and I was supposed to be out for the season, but I used the Wolverine stack, and I was back in 2 weeks playing again. That is how good it was. If you have chronic back pain, it's a great alternative. Now the third one that I will recommend is actually a nootropic. It's going to be through the nasal. It's called Samax. Samax it was created in Russia a while ago, but it's pretty much an alternative and a safer, less addictive. It's not addictive at all. It's just a safer Adderall, because Adderall is so well known and used by everyone. It's just a lot of people will use it and they'll get withdrawals and they'll be sad when they're off of it, and they just can't function as normal human beings without it. So Samax is going to work great. I used it through nasal. It's a good start. It's going to give you great focus, mental clarity, and you're going to get pretty much an instant effect of feeling it. And using it as a first-time peptide user, it's going to be nice to see some effects immediately. Obviously, a lot of the other ones are going to take longer, like the Wolverine stack takes a little bit to notice. GHKCU, you'll notice within a couple weeks, but this one you'll pretty much notice within a couple days, and you'll feel great. So that's going to conclude it for the video today. Hopefully you guys learned something. Maybe you can now, look into peptides more confidently and get started about everything that you need to know. It's very simple. I plead to everyone. It's very simple to get started. It only gets complicated if you think of it as it being a crazy complicated thing, because big pharma makes you want to be confused. They want you to be so confused that you just listen to the doctor's orders and don't even follow through with anything because you just listen to them. They're going to prescribe you things and they're going to be painkillers. They're just going to beat around the bush instead of actively attacking the issue. Like peptides. Peptides are going to actively attack your issues and fix them. I hope people they stop listening to their doctors so much, because they're just trying to make a quick buck. I hope you know a lot of doctors out there, they're not looking for the best out of you. Now, yes, there is going to be, situational where doctors are going to be, you need to listen to the doctor, but a lot of times when it comes to you have chronic back pain or something, a lot of times there's a deeper issue other than a painkiller. And that's just, I'm trying to push that out there to the media, because it seems like it's not talked enough, and people don't even try to test the doctors, because they're so knowledge dependent. They're 12 years of college and you're just a dude who's working a normal job and you don't know what to do, and you're just trying to live a healthy life again, and they're just making your life worse, and you're getting prescriptions every week. I'm just trying to reach out to you guys and actually help the deep-rooted issue within the healthcare system currently. There's a gap in between the knowledge between you and then the doctors. That's what they want. They want you to not be able to understand what's actually going on, so they use these crazy terminology, and they'll just confuse the heck out of you into pretty much being a salesman to you and then selling you some sort of prescription drug that now you're stuck on for the rest of your life. As of Adderall, giving them to 6-year-olds, and then, they're stuck because they were too hyper. So it's a very, very stupid situation. But otherwise, if you guys want to check out my TikTok, Instagram, I post on TikTok pretty much daily, and then link to all the peptides and whatnot is all linked in my bio. I'll see you guys later. Peace.